Hello, hi. Today I'm going to be speaking about hemolytic uremic syndrome, high-yield USMLE step 1 review, and I'm going to be going through a question for that. I prepared a question for this, but before I go through the question, I want to kind of tell you my approach, how I break down a question, especially when I'm tutoring a student. So the way I kind of break down a USMLE question analysis with students is, first of all, we always start with the last line. So when we're studying for step 1, they usually ask about pathophysiologies, mechanism actions, and when I'm reading step 2, then they usually ask for next best steps in management. So that's kind of really key to look at over here. The second thing is highlight the keywords of question yet. There are some keywords which will be the clue words, trigger words, which are going to help us find diagnosis, find next best step managements, and that's really key that I do look when I'm working with a student. After that, number 3 is review any lab values or images, like any chest X-rays, any CT scans, any MRI images, or lab values. That can be your hemoglobin counts, that could be your thyroid stimulating hormone, or any sort of cell electrolytes that we can clue us to a diagnosis. Predict before looking at choices. So yeah, before we look at the choices, I would want to predict. Oh, does this patient have MI? Does this person have celiac disease? Does this person have Plummer-Vinson syndrome? What is he kind of happening? So we have an idea before we look at question answers. And kind of the next thing is process elimination. So I go through every single question. It's usually USMLE have questions have 5 options. Yeah, sometimes 4, but it's usually 5 to 6 even. But it's usually 5. So we go through every question and we kind of cross it till we find the right answer. And here's the question over here, which is based on Hemolytic Uremic Syndrome. So as I said, we're going to look at the last sentence first. Which of the following is the most likely underlying mechanism of this patient's condition? Right here. Then let's come over here. We read over here, a 4-year-old boy is brought to the ED. So that's a keyword, a 4-year-old boy with decreased output and decreased urine output and fatigue. So that's another keyword. Decreased urine output is hinting towards that we're having kidney failure and fatigue. Or 1 week ago, he had bloody diarrhea. Now, that's a very important prodrome that occurs maybe before hemolytic syndrome, before Campylobacter jejuni, bloody diarrhea. And after eating undercooked hamburgers at a family barbecue, on examination, he feels pale and has mild peripheral or periorbital edema. Now, let's come to lab. Lab studies show hemoglobin is 8.2 grams per deciliter. Over here, I would engage the student and ask him what are normal hemoglobin values. I've written over here, but I would ask him what is the normal hemoglobin values. And then we can kind of determine, oh, he's having hemoglobin. So I'd ask the student, I would actively involve him that, oh, he has low hemoglobin levels. What are we thinking about? So hopefully he would say anemia. And then we can see the next thing is platelets. Again, I would ask the student, what do you think normal platelet counts are? And hopefully we would conclude we're having thrombocytopenia over here. After that, I would ask him about creatinine as well. And we would conclude we're having kidney failure, high creatinine, and peripheral smear histiocytes. Now let's come to the first option. So it's going to be C1 esterase inhibitor deficiency. Over here, I would engage a student, ask him like, what does he think this means? So hopefully he would say hereditary angioedema. And I would kind of ask him, I would just kind of walk through the pathophysiology of hereditary angioedema with him. So I would kind of ask him, oh, okay, so here we have C1 esterase inhibitor deficiency. We're going to be getting what would kind of happen to our callicarine over here. So callicarine would, of course, be quite high over here. And then what happened to our bradykinin? So bradykinin be quite high. So it's an uncontrolled process. So I just ask him, if your bradykinin is high, what kind of symptoms you would expect to see over here? So hopefully he would say kind of angioedema, swelling, labial swelling, facial swelling, throat swelling. So that's completely wrong because we have none of that over here. The next option is Shiga toxin mediated endothelial damage. So over here, in Shiga toxin mediated endothelial damage, I would kind of also engage the student over here. So if we're getting damage to Shiga toxins, especially in our renal glomeruli, what do we kind of expect? So I would kind of like draw a diagram with him over here. So if we're getting damage to endothelium, we're going to, of course, be in a prothrombotic. We're getting damage to endothelium, so we're getting into a prothrombotic state. And that's going to be, if we have too much thrombosis, what's going to happen to red blood cells going past? So hopefully he's going to mention that there's going to be a lot of stress, so there's going to be anemia. And then I will ask him if platelets are being consumed in the thrombus, what will happen to overall thrombocytes? So hopefully he would say thrombocytopenia, which you're saying over here. And if I ask him if you have too much thrombosis in the renal glomeruli, what will happen to renal GFR? So he said renal GFR will be decreased and therefore have kidney failure. So this is a possible answer. Then let's come to the next option over here is antibody formation against Adams TS13. So over here, I would kind of ask the student, what's Adams TS13? So hopefully you would say it's a von Willebrand factor cleaving protein. And once we know it's a von Willebrand factor cleaving protein, we have a lot of von Willebrand factor. So we're going to get a lot of clumping, a lot of thrombosis, right? So is it kind of similar to the previous condition? Yes, we're getting thrombosis, right? So I'll ask him what happened to platelet levels. Platelet levels be low. I would ask him about anemia, so that anemia would kind of also be low over here as well. And then I would kind of ask him about if you get too many thrombosis in the renal glomeruli, what do we expect kind of the GFR to be? So we decrease and we kind of get the same prodrome. But then I would ask him, this Adams-Stevens 13, what syndrome is this referring to? So here he would say it would be TTP, so thrombotic thrombocytopenia purpura. And then I would ask him, is this more common in adults or children? So he would hopefully say adults. And this is, of course, a child. Then I would ask him about the prodrome. So he'll say there's not really much of a prodrome. So we had a prodrome of bloody diarrhea. So that points more towards our second option, which is Hemolytic Uremic Syndrome. And I'll ask him, is thrombocytopenia, what's the kind of the clinical features here? So hopefully you'd say that we're going to have fever, neurologic symptoms, which are not seen over here. So therefore making this answer also incorrect. So then I would come over here to immune deposition at GBM. So I would again engage the student over here. I would kind of draw a glomerular-based membrane over here and be like, if we're getting antibodies attacking this, what is kind of symptoms to be expect? So hopefully he would kind of mention that we're getting we're getting hematuria, proteinuria, hypertension, which are nothing as shown over here. So we could easily then cross this out as well. And then I would ask him about anti-double strand DNA over here. And this would be like, I would hopefully kind of ask him about this, and hopefully he would say about that fact that we're going to be getting, we're going to be getting lupus. And I would kind of go through all the symptoms of lupus with him over here. And as we know that lupus has a mnemonic over here, I've mentioned also here, MD soap brain. So MD, middle rash, discoid rash, and we have other parts of MD soap brain, which this patient does not have. So that's kind of overview how I would go for a question. When I'm kind of teaching this theoretically with a student, I try to ask them what's their concept of hemolytic uremic syndrome, what's the pathophysiology behind hemolytic uremic syndrome, and I would also ask them what are symptoms that a patient present with hemolytic uremic syndrome. And I would also give the student a mnemonic. So I have a mnemonic here for hemolytic uremic syndrome. I believe mnemonics are really great as memory anchors, so I would definitely give that. And then I would kind of go through the hemolytic uremic syndrome with him. That is basically the underlying cause of thrombosis. Why do we kind of get thrombosis? And kind of speaking to about the source, which is unpasteurized milk or undercooked meats. Speak about the bacteria 0157887. Kind of give him a whole diagram over here and get into details with him. Then I always use the teach-back method with students. I try to ask them, you've understood this topic. Can you explain it back to me? So that's something I would do. And I've kind of given a table over here. All the stuff that I've kind of highlighted over here, these are kind of just like keywords from the USMLE, like thrombocytopenia, thrombocytopenia over here. We kind of spoke about this decreased hemoglobin. We spoke about the prodrome blood diarrhea. We didn't speak about lab values, but that's also a common finding that is shown in USMLE vignettes. So that's something I would definitely do with the student. Again, kind of giving a mnemonic over here for hemolytic H as in hemolytic, U as in uremia, S as in schistocyte. So I always give mnemonics. I think they're great memory anchors. I also always give my students flashcards. So I made some flashcards over here. And here are the answers on the side. So I'll definitely give that for homework so they can do flashcards to make sure that they're remembering these topics. Here are some more example flashcards that I made for my students. And then over here, my teaching principle has 6 key principles. I like to understand their understanding. I try to build on that understanding. I define knowledge gaps. And then I always give a memory anchor, like I showed by mnemonics. And then I always do a USMLE style question to check like their active recall, whether they understood the concept. And I always give homework, like flashcards. I think flashcards is a great source of homework. Now coming to statistical testing. So over here, we have over here, I would like to speak about these 2 tests, t-test and ANOVA. So t-test, essentially, we check the differences between means of 2 groups. So we're comparing the means of cholesterol levels between men and women. And that's an example. And over here is going to be the mean men cholesterol levels 180 versus mean women cholesterol levels is 190. And t-test essentially is, I have a mnemonic here, t-test as in 2 groups. So men versus women. ANOVA analysis of variance. So this checks the difference between 3 or more groups. So we're checking the mean cholesterol level between 3 ethnic groups. So Asians, African, Hispanics. So we have Asians cholesterol group is 160 milligrams per deciliter. Africans cholesterol level is 170 and Hispanics 180. And 3 words analysis of variance. That's a way you can kind of learn analysis of variance. So you have 3 groups or more. The next thing is going to be a Fisher exact test. So we're looking at differences between 2 percentages or proportions. And these are more nomical. Nomical over here, it kind of means like, nomical means like your name. So that's a keyword over here. So I'm kind of going to highlight that over here. And that's going to be, instead of using chi-square or small populations. And what's an example of that? So I'll kind of engage the student. What does he think an example of this is? So that's quite simple. Smokers versus non-smokers. So we can see over here, yes, so smoker versus non-smoker who develop cancer, who do not have any cancer. Chi-square are asking the same thing, what do you think it is? And it's kind of like the bigger version of this. So check the difference in two more percentages or categories non-mean values. So over here, male versus female, without graduation, college, bachelor, master degree. So male versus female, but it's education status. So that's kind of overview of how I try to do statistical testing and how I teach hemolytic uremic syndrome. Hopefully, this video was useful. Anyone watching, thank you and for having me.